Thank you.
You're welcome.
Good afternoon, everyone. I'm Dr. Nishant Sharma from Voice of Healthcare, and I welcome you to a panel discussion on the topic Holistic Approach to Addressing Diarrhea Challenges. This is a Dr. Reddy's initiative to stop Distress India RIA, organized by Voice of Healthcare and supported by United Nations Global Compact. Today, we will be talking about the different facets of diarrhea, talking about how to integrate health, industry, and the policy perspectives. So we have a good and a very expert panel of different industry experts. Allow me to welcome my panelists. I'll start with Dr. Somnath Singh. He's Deputy Director at UN Global Compact Network India. Good afternoon, Dr. Singh. Thank you for joining. It's a pleasure to have you here.
Good afternoon. Good afternoon, Dr. Nishant.
Yeah, we have Dr. B.S. Ramakrishna, Director, SIMS Institute of Gastroenterology, Hepatobiliary Sciences and Transplantation at SIMS. Good afternoon, Dr. Ramakrishna. Thank you for joining. Thank you, sir. We have Dr. Rupa Banerjee, Senior Consultant, Gastroenterologist, Director, IBD Center at AIG Hospitals. Good afternoon, Dr. Rupa. Thank you for joining.
Thank you. Thank you so much.
We have Mr. Prashant Mahalingam, Cluster Head at Dr. Reddy's Laboratory. Good afternoon, Mr. Prashant. It's a pleasure to have you here.
Good afternoon. Thank you. Thank you for the introduction.
And we'll also be having Dr. K. Madan Gopal, Advisor, Public Health Administration, Ministry of Health and Family Welfare at GOI, who will be joining us shortly. He's in the middle of a cabinet meeting or some minister meeting. So we'll be having him join us shortly. To start this discussion, Dr. Ramakrishna, my first question will be for you. I hope I'm audible to you.
Yes.
All right, sir. So as a clinician, can you please elaborate on the causes and the prevalence of diarrhea in India? And it's a multi-part question. And I would also want you to talk about adult diarrhea and its prevalence on the life of an individual. Please, Dr. Ramakrishna.
So diarrhea, generally we are talking about infective diarrhea here. There may be non-infective causes of diarrhea, which I'm not going to talk about. So infections can be bacterial, they can be viral, or they can be protozoal. So probably if you take overall, probably virus causes of diarrhea are more than bacterial causes of diarrhea. But the bacterial causes of diarrhea can be very alarming sometimes because they lead to some complications. They can be very severe, like in cholera, where you lose a lot of water in the stool.
Mm-hmm.
So these are largely the three main causes of diarrhea. So amongst the bacteria, most of them, they are the ones that produce toxins. These toxins induce water secretion and cause diarrhea. There are some organisms which cause ulcers in the intestine and cause diarrhea. And this is something that we call dysentery, where there's blood and mucus diarrhea. So these are the main causes of diarrhea. Now, the problem with getting prevalence statistics is that nobody really reports diarrhea in a sense. It's not something which is captured by a public health database unless you report isolates of Vibrio cholerae or something like that.
Right.
So the estimate is, according to the world statistics, is something like there may be 4 billion episodes of diarrhea a year around the world. That could be an underestimate. So that means, on average, each person has one episode of diarrhea a year. There may be some people who have none, and there may be some people who have 8 or 10 episodes of diarrhea a year. So the problem is most acute in children, as you're aware, and there is where it's a major cause of concern because children very quickly can become dehydrated and die. This can also happen at the other extreme, in very old people, where again, unrecognized dehydration can lead to complications like blood clots in the brain, or to a heart attack, and to a stroke, and so on. So these are conditions that we need to think about. So most infectious diarrheas, if it happens to an average adult, the adult is able to, the immune system is able to take care of it, and they come out of it. There are a few which can be fairly severe, like cholera, for instance, can be very severe. Of course, if you're susceptible to something, it can lead to complications. As I said, at the extremes of age, we need to worry more about the consequences of diarrhea and whether it will cause morbidity and death.
Right. Thank you, Dr. Ramakrishna. We'll also like to hear some preventive measures as a clinician that you can talk about, taking in consideration to minimize the adverse effects of diarrhea that we see in adults. Some preventive measures from you, please.
Okay. Now, you'll realize that most of the gastroenteritis and diarrhea is foodborne, food and waterborne. So the main preventive consideration is to ensure that you have clean drinking water, that the food you eat is clean, that, typically if somebody goes out and eat, and particularly in the rainy season, right now in Chennai, we've had floods. And this is the time when for the next couple of weeks or a month, we expect a lot of gastroenteritis. Adults with diarrhea, some of whom have complicated disease. So this can be avoided if you take basic precautions, which is to ensure that you have boiled or filtered water, to ensure that whatever food you eat outside is properly cooked, not to eat things which are not cooked, where there may be contact with hands which are not totally sanitized. So not to eat cut fruits, not to eat salads outside of home. I think these are the major preventive things that we think about.
Thank you, Dr. Ramakrishna, for setting the introduction and explaining to our audience about what diarrhea is, some common symptoms, and talking about the preventive measures. I'd now like to welcome Dr. Madan Gopal. Hi, Dr. Madan Gopal. Thank you for joining. You're on mute, sir. If you can maybe unmute yourself.
Yes. Good afternoon. Sorry, I have to join this way because
Good afternoon.
I'm talking from Bharat Mandapam. So having this is the lunch time, and that's why I could speak to you. Otherwise, it would have been very difficult thing for me.
Thank you, Dr. Gopal. Without taking much of the time in this, I'll take my next question with you. So my question to you will be, can you share some existing public health programs and initiatives that are aimed at preventing diarrhea? And can you also share the importance of education, hygiene, and please talk about how it promotes in combating adult diarrhea? Please, Dr. Gopal.
You have asked a very pertinent question. I think if you analyze the under 5 mortality, the post-neonatal, the infant, and the post-infant mortality, more or less major contributors have been diarrhea and your pneumonia. And for the last many years, I think around 3-4 decades, there have been programs which are addressing on these aspects. We first had that child survival and safe motherhood, then the RCH programs, now the national mission. And these kind of programs are there. You see, if you look at the under 5 mortality, it is 37, and 86% of the deaths, and diarrhea is one of the leading cause for under 5 mortality. That's one thing. Second thing, you talk about the daily and other things also. It is a major contributor for that. More than 14 million, that means 1.4 crore daily are estimated because of diarrhea. You see that looking at the importance of that, apart from the regular your programs through your health and wellness center, your Ayushman Arogya Mandirs, which were erstwhile health and wellness center, and the other programs which I mentioned, we started with child survival, safe motherhood. There's still programs are there, and people are being trained for that. So we are trying to see that because we have identified diarrhea as one of the important That's why we are having since 2014 the intensified diarrhea control fortnight. That means every year on an annual basis, we have been targeting the peak season based on the epidemiological evidence. That means these are the duration peak period where the diarrhea episodes are more. So what we are doing, we have capacitated the 1 million ASHA workers for distribution of zinc and ORS. The interventions are very simple for this. One of the reactive interventions are very simple. That means you provide ORS and zinc to the masses during the diarrhea episode so that you can reduce the mortality. And if you look at the way things have happened, so every year we are targeting around about 10 crore children with this ORS packets and the zinc tablets during. It's not that they are being provided. At least that the the places have been given this thing so that in case of any diarrhea episode and other things, the dehydration aspect as well as the recovery aspect has been taken care by. These are the public programs which are there. Apart from that, we do have a regular interaction in the form of village health and nutrition days. So that is a very common and institutionalized mechanism wherein the health workers interact with the community, they address the community that how the diarrhea can be prevented and how the things can be taken forward from there. So apart from that, we do have a Swachh Bharat mission, wherein we have been trying to see that how just doing a just basic interventions into the sanitation and the water side, you can avert around 3 lakh deaths every day. That means since 2014, the scheme which has been launched, we have been able to avert around 3 lakh diarrheal deaths. Beside that, you see that how the Jal Jeevan missions and other things which the government has been doing so that the clean drinking water is provided. That means from the reactive approach, that means taking care of the diarrhea episodes through ORS and zinc tablets. Now we are having a proactive approach in preventing diarrhea through the Swachhata Bharat mission, providing free clean drinking water as well as building capacity programs. The second thing is now the Swachhata Bharat Abhiyan. Now you see that how the importance and impact which it has on the school and the hygiene of the people. And the recent COVID epidemic also has highlighted the importance of keeping the hygiene. So you see that it's a overall it's a 360-degree approach. That means previously we used to have a reactive approach. Now we are having a proactive as well as reactive approach. It has now become a holistic approach. So, with the number of institutions which we are having, the network is there. We have invested into the strengthening of the health systems. The health systems right now, if you talk about the peripheral most health worker, we do have a presence in all the villages, and all the health workers they have been trained on a regular basis. It's not a one-time training. Every time they are trained so that whatever they have learned in the past that is refreshed during the subsequent training. So with this kind of approach, I think the number of things which we have done, that means the medical cost averted, how much expenditure we have averted. You see that around 8,024. Some of the studies they point out that we have been able to avert 8,000 rupees per household. And major thing is still the out-of-pocket expenses in the country is around 45-48%. You see that even a small amount of 8,000 rupees, if you are able to avert because of proper treatment of diarrhea, so you see that how we have averted that. And apart from that, you see if a diarrhea episode is there, there is a morbid condition. If that's someone, the study has interestingly costed that the value of time which has been saved because of our interventions is around 24-25,000 rupees. And if you talk about the value of the other things, the property saved, it could be around 19,000 rupees. You see that what kind of our intervention, whatever interventions we are doing, as we have moved from reactive to proactive approach. So this is all yielding results. And every year it has now become an institutional mechanism. That means every year automatically states they have identified the pockets. They try to focus more on making the intensified diarrhea control program a successful program. So that kind of focus is there. Apart from that, the capacities of the volunteers who are there in the village level, the ASHA volunteers, you see that how they are becoming a game changer for diarrhea management. Still, we are struggling. The under 5 mortality is high, and one of the leading cause is diarrhea. And beside that, one more thing is that as a preventive measure is the rotavirus immunization. The leading cause of diarrhea in the country is rotavirus. So we have a rotavirus immunization program that's part of the universal immunization program of the government of India. That means overall, protecting the person against rotavirus, creating awareness, uh, provisioning of the medicines and the other things, plus
Mhm.
when the person is sick, providing treatment. That overall mechanism is there to our diarrhea and diarrhea-related deaths and other things. Thank you very much. Thanks for this opportunity.
Yes, thank you. Thank you, Dr. Gopal. It was a very, I would say, a very 360-degree answer, a very quite matured answer you gave. Thank you for that. Dr. Somnath, my next question will be for you. It is in continuation to what Dr. Gopal had just mentioned. Now, talking about how can public-private partnerships be used to promote preventive measures and public health initiatives, and also what initiatives are already undertaken by UNCGI to promote such public-private partnerships, and I'm very specifically talking about adult diarrhea and its prevention here. Dr. Somnath. Sir, you're on mute, please.
Thank you, and other eminent speaker. First of all, let me congratulate you to just plan this fantastic panel discussion on the holistic approach to addressing diarrhea challenges, integrating health and industry and policy perspective. So I think today this is not 18th century or 19th century when cholera and diarrhea caused the death of many people, and these diseases are not as a cause of worry as they once were. Being Indian, we need to be happy that we defeat diarrhea, but still we need to do more effort, especially in rural India where people have less awareness and limited access to quality health care. So when you just talk about the prevention, that what preventive measures are there where public-private partnership can contribute. So first of all, let me just look at the preventive measures that exist in India. The preventive measure includes the measure or steps taken for the prevention of disease as opposed to disease treatment. Preventive care stages are typically, described as taking place at the primary, secondary, and tertiary prevention level. So, when you just talk about public-private sector, partnership. So definitely to strengthen healthcare sector, public-private partnership is very much necessary or compulsory for both the sectors to strengthen healthcare sectors. Because in simple words, if I just explain, public-private partnership that works on a mass scale can assist in making services affordable while retaining quality standard. This would enable to provision of quality healthcare to everyone at an affordable price, creating better access to a wider part of the population. So this line which I have just explained, that everyone should have access to affordable price and better access to the quality healthcare. This somewhere keeps us aware that public-private partnership can play an important role in preventing diarrhea kind of disease. So this PPP model can play a crucial role at 3 stages. One is primary prevention, where intervening before health effects, where the different sectors can contribute, can help government and other public department to create awareness on healthcare, especially on diarrhea, which is we call the life killer. And the second prevention is screening to identify disease in the earliest, when the person is diagnosed, and when there is lack of screening and providing the patient and the family full support so that a patient get benefit or can cure. And the third stage is territory prevention, managing disease post diagnosed to slow or stop the disease diarrhea. So this is the basic scenario where the PPP model is very much compulsory to strengthen healthcare sector in India. When it comes to the United Nations efforts, that how and what platform we are just providing to strengthen the public-private partnership. So to begin with, I would like to just mention a brief overview about the United Nations Global Compact, which is a call to companies to align their strategy and cooperation with 10 universal principles related to human rights, labor, environment, and anti-corruption, and take actions that advance societal goals and the implementation of the SDGs. The United Nations Global Compact was first proposed by the United Nations Secretary General Kofi Annan in 1999 and formally organized the next year in July 2000. So, when the mandate was framed in 2000, so we started working on that, and recently in 2015, we have implemented sustainable development goals, and goals 3. I think this talks about good health and well-being. So United Nations Global Compact has, a broad strategy, broad way to strengthen public-private partnership. So we just generally, emphasize on partnering with the UN system to advance the Global Compact 10 principles. So we are not even, developing partnership with the, companies, with the private sector. We also, develop partnership within the UN systems, that different, UN organization. Those are working on health issues and other issues. So in this, context, the Global Compact works with entities across the UN system to mainstream the 10 principles into how they engage with the private sector as well as their own internal UN operations. This occurs primarily through issue-specific collaboration, and we also have very strong, platform where we help businesses to develop and strengthen partnership with different sectors, whether it is pharmaceutical sector, whether it is health organization, to support them in different I think the aspect where there is a preventive care is required, where there is the screening is required, where is treatment is required. So for that purpose, we have very strong partnership platform here. And one more platform that we provide to the private sector, that is the training, but training not only to the private sector but also the healthcare sectors, so that they can train and they can get aware of the services, the schemes available at the government sector as well as the companies level. And also we have the biggest thing that we provide to the public and private sector is the networking, because this is United Nations Global Compact is a membership driven organization where we just brings all the sectors together to support each other. So we generally provide them networking opportunities through various events, various meetings, various deliberations, national and global the events we organize. Recently, we organized a private sector forum, which has already started from 10th December to 15th December in Atlanta. So, number of, private companies from the pharmaceuticals have, participated there and also share the kind of challenges they are facing. So we also provide such kind of, platform to the private sectors. And we also, engage, the private sectors to help UN system also to take their agenda forward, whether it is healthcare agenda, whether it is, the women empowerment, whether it is, any of the goal among the 70 sustainable development goals. So, through this, I think the scenario, when a company, when the civil society organization, healthcare organization becomes our member, we started giving them full support to engage with the private sector to share their challenges. So what I think, just looking at the scenario, healthcare scenario of India, these 3 steps of preventive care, definitely a collaboration through public-private partnership can be developed, where we can just strengthen healthcare sector in India. So cross sector collaboration generally we focus on for strengthening healthcare sector in India. So these are the few initiatives that we are just taking at a global compact level. And I think because this time we have more than 18,000 members, businesses or non-businesses globally, and in India we have 500 members. So somewhere we can just provide a platform where they can collaborate, share their challenges, and help each other. To such, we can definitely help strengthening healthcare sector in India. Simple, and I think I'm over here. So if you have any question,
Thank you.
definitely just
Thank you. Thank you, Dr. Somnath. That was a really insightful answer talking about the public-private partnerships. Thank you for sharing your views on that. Dr. Rupa, my next question will be for you. As an expert in the area of inflammatory bowel disease, my question to you will be a multi-part question. First is, I want you to explain to our audience what is IBD, what is its incidence that we see in adults in India. And second, which is a more primary question for me, is how closely is IBD associated with adult diarrhea? Yeah, over to you, Dr. Rupa.
I think we have been discussing infectious diseases all along, and Dr. Nishant, you would know that we got wonderful insights from Dr. Madan, Gopal, Dr. B.S. Ramakrishna, and Dr. Somnath. What has happened is India is changing. So traditionally, we were a country where infectious diseases dominated, and we were dealing with all the infectious causes of diarrhea. Over the last few decades, I think it would be around 2 decades at max, there has been a change. We have made significant changes in our socioeconomic status, in our availability of things. We have mineral water. We have, we made all the good advances. But at the same time, our traditional eating methods changed. Pollution increased. We got addicted to the so-called, I call it the SAD diet, the standard American diet. With that came inflammatory bowel disease. These are kind of autoimmune, non-infective causes whereby there are ulcerations in the colon, in the small bowel, and can cause chronic diarrheas. So we are right now at an epidemiologic shift. Infectious diseases are coming down or stabilizing thanks to all the efforts from the government. But now the lifestyle diseases like obesity, reflux disease, inflammatory bowel disease are on the rise. So this is now becoming a very important part. So we conduct actually a rural camp, where gastrointestinal services are provided at the doorstep to the villages. Village after village, we see so much improvement. Pakka houses, better roads, water. But there is a fast food shop in every small village. The traditional foods are changing. So we don't see malnourished kids. We are seeing obesity and we are seeing inflammatory bowel disease. So I think the perspective now from all standpoints is again to see how we can prevent this epidemic of inflammatory bowel disease from happening. And I think, again, as we did for infectious diarrheas, this will need multiple level of partnership. One, for the treatment, because this is a chronic, lifelong disease, inflammatory bowel disease. The medications are costly. It will impact the healthcare budget, be it the personal budget or the insurance or the government. It will impact. So we also need to work on prevention and awareness. So I think this is where we stand as far as inflammatory bowel disease is concerned. It's rapidly increasing. And this is a slow epidemic which we are seeing, perhaps not realizing, but it's bound to be a major healthcare factor in the years to come. So what was an American disease earlier is now an Indian disease as well.
Right. Dr. Rupa, the second part of this question was, how closely is IBS related to adult diarrhea? As a clinician, we'd like to hear your opinion on that also, please.
So I think this is a good question, but let me first clarify. IBS is irritable bowel syndrome, which is entirely different from IBD, which is inflammatory bowel disease.
Okay.
So IBS is a very common condition, has numerous factors which is impacting it. Could be, stress factors can impact. Sometimes dietary triggers are there. Patients do suffer. There is a large volume of patients with irritable bowels, as we call them, having either diarrhea or constipation or the combination associated with indigestion and other factors. Stress, as I said, could be a major factor. And IBS has been prevalent, will be prevalent. There are a lot of medications for irritable bowel. The other is IBD, or inflammatory bowel disease, which is a disease with extensive ulcerations, can be mild, can be moderate, can be severe, present with diarrhea, weight loss, anemia, growth retardation in children. Awareness is needed because we conducted a study, and in India, all IBD, the minimum time for confirmation of diagnosis, particularly for Crohn's disease, is almost nearing 1 year. They go for 2 to 3 physicians, receive multiple antibiotics before a colonoscopy is done, and the diagnosis of inflammatory bowel disease is done. So we see children with growth retardation because they've just had antibiotics with multiple courses of diarrhea. So the awareness needs to increase that if there is a patient who is having recurrent diarrhea, sometimes blood in motion, there is weight loss, or there is unexplained anemia in children, these are the cases that need more evaluation, needs a colonoscopy and other evaluation to confirm the diagnosis of inflammatory bowel disease. So I think we have to get together again, as this panel here is, to work out the strategy for non-infectious causes of diarrhea as well.
Right. Thank you. Thank you, Dr. Rupa. It was a really wonderful and insightful answer. Thank you. Mr. Prashant, my next question will be for you. So, how do pharmaceutical companies actively contribute to the research, development, and the widespread distribution for the treatment of diarrhea? And my second question for you will be any initiatives that DRL is currently taking to address adult diarrhea, as you know. Over to you, Mr. Prashant.
Okay, thank you, Dr. Nishant. Dr. Reddy's purpose reads "Good health can't wait," and some of the principles that we operate with are quite universal in this, right? So, first part of it is bringing access of medicines, and even very, we spoke about ORS being one of those critical interventions for diarrhea of infants to keep the infant mortality down. But access to medicines is a very critical part, and this access actually over thanks to the infrastructure increases in the country, what we are seeing now is more and more medicines which were available only in the cities are going down different population strata to smaller towns and to villages. And there is across the industry, I think this is a phenomena where we are seeing more drugs which were originally for what used to be for acute conditions. Now a lot more of drugs for chronic conditions are getting access to smaller towns and villages. That's one, which is accessibility to medicines. Second is, of course, the right medicines, providing the right portfolio of medicines required to treat diarrhea, infant diarrhea, adult diarrhea, IBD, IBS. And this is really at a portfolio level, everything from simple interventions like ORS to probiotics to antibiotics. So I think the entire portfolio of drugs required to manage various conditions and continual innovation in that. We have moved from a simple medicines at one point of time to more targeted medicines which have been proven through various trials to work. So the second piece is really bringing the right portfolio of medicines and also keeping these medicines not very expensive, bringing them within reach of the common man. And that is something that the Indian pharmaceutical industry has contributed immensely by actually bringing some of the medicines which are actually very expensive when you look at globally, to bringing it within reach of the common man in India. The third is really addressing what I would say is unmet patient needs. This is addressed both in one way through the portfolio pieces that we spoke about. In another way, it is also about bringing in new innovation, new products which take care of current and the future needs. The fourth is about helping patients manage the disease better, right? And what we have seen is beyond the intervention that, as the government can do, public institutions can do, or the healthcare community can do, there is also tremendous benefits of making sure that patients themselves get more aware. Patients themselves are able to understand what is needed to be done, so that there is no delay and there is no waiting time or a disruption because they didn't identify the symptoms or the level of severity of some of these conditions. And this means both very proactive outreach efforts by the various companies to firstly educate patients, sometimes updating and the healthcare community of what can be done on leveraging sometimes the community together to inform the patients about how better to treat different conditions that may be there. And finally, it's also enabling, I mean, the pharmaceutical industry works with an ecosystem of partners, which includes everything from the supply chain teams who manufacture, to the logistics team, to distributors and the distributor community who make sure that access is there to the various chemist shops, the pharmacies who are dispensing this, the doctors who prescribe the products when the patients come to them, the patients themselves, as well as the government institutions, the hospitals. This is a big ecosystem, and in each one of them, there is an impact that we can make. And there are various interventions. Some I've already spoken about, but some also include partnership with hospitals, partnership with schools, for example, to better educate the patients and the community at large about what can be done. So, broadly, if I were to summarize where all is the pharmaceutical industry and Dr. Reddy's having an impact, is really in terms of bringing the right medicines and keeping them within reach, affordability, creating access to these medicines deeper beyond the cities and the towns to smaller geographies, addressing unmet patient needs, and that means innovation and bringing the right products, R&D, for example. Fourth, managing and informing the patients to manage the disease better, both proactively as well as reactively, through education programs and partnerships with the medical fraternity. And lastly, working as an ecosystem together to disseminate information and to ensure that the products reach the right people at the right time. And this is the entire ecosystem working. Specific initiatives, touching upon these same points. I think we do have a portfolio spanning everything from the ORS under the Rebalance brand to Ridotil, Econom, which is a probiotic, Sibofix. So there is a spectrum of portfolio that we offer. We work especially in with schools camps for infant diarrhea, to inform and educate at on how to have better hygiene, as well as for intervention, because this is a great partnership that we have with schools, the healthcare community. Um, there are IBS diagnosis camps, diarrhea kits, as well as partnership with hospitals in terms of augmenting some of the paramedics also on emergency handling, as well as working with dietitians on dietary modifications through our dietlogue series. So a lot of programs spanning across all of these spectrums, We do, but I do think pharmaceutical companies definitely have a very important role in management of diarrhea in India, and we are very privileged that we can contribute to this as Dr. Reddy's in some small way to help manage this condition in the country.
Thank you, Mr. Prashant. That was a really insightful answer. With this, we'll move over to the second round of discussion, talking a little bit about the policy perspectives and awareness and about the community education. Dr. Ramakrishna, my next question is for you. I hope I'm audible to you. You're on mute, sir. If you can maybe unmute yourself as well. So my question to you will be, considering your clinical experience, we'd like to understand the challenges that you have faced in treatment and management of diarrhea in adults.
Sorry,
You had some noise.
you hear me?
Yeah, we can hear you, sir.
All right, sure. So, right. So the clinical challenges in managing diarrhea, is that what you said?
Right, sir.
All right. So clinical challenges in general, managing diarrhea, there is not a huge clinical challenge provided one uses common sense. The main issue in diarrhea is that people lose water and they lose electrolytes. We know in approximately what proportion these water and electrolytes are lost. So if you use the appropriate replacement, which can be given orally or it can be given intravenously. So let's start at oral. So somebody who has a diarrhea and is at risk of dehydration, and if the diarrhea is not very drastic in the sense that they don't become overtly that with mild dehydration. So basically, we encourage them to take regular fluids available at home, including things like tender coconut water and maybe things like lime juice with salt or buttermilk with salt and so on, which allows absorption of water and salts. Now, once it goes to a little beyond that, then one has to give oral rehydration solution. That is usually in the correct composition, which allows good absorption, while it doesn't necessarily stop diarrhea, but it prevents dehydration. What the challenge I find in hospitals is that very often people at the base level who are treating them first contact do not necessarily give the right intravenous fluids to somebody who comes with severe diarrhea and severe dehydration. In this setting, what requires is to give a balanced salt solution, and typically we use something called ringer lactate to give intravenously. This is for someone with severe dehydration. And then again at the extreme, so these other issues, there are no, I would say that there's no challenges, it's basically common sense. Challenges occur when in resource poor conditions.
Okay.
Don't have availability of medical aid, where you don't have quick access even to a primary health center. Those are situations where there would be challenges to management of diarrhea. And that is where people with diarrhea succumb to their illness. So, as I said, children are most vulnerable to die from the rapid dehydration. But today you are focusing on diarrhea in adults. And in adults, in the elderly, this is where somebody who is not attended to immediately, that person can develop a heart attack. That person can develop a venous thrombus in the abdomen and give rise to grave complications. So those are challenges. The second thing is that diarrhea is sometimes there's a misuse of antibiotics. In general, an immunocompetent adult, normal, let us say people within the age ranges of say 12 to 55 or 60 would not require antibiotic because their body is perfectly capable of overcoming the diarrhea provided they have access to good hydration. So unnecessarily antibiotics are used, which lead eventually to antibiotic resistance in the community, because these bugs become resistant, they are excreted in the stool, they go and contaminate water sources, and the next person gets an antibiotic resistant diarrhea.
Right. So, Dr. Ramakrishna, thank you for that answer. In addition to this, in this digital era as we live, I'd like to hear from a clinical perspective, how much do you think the awareness of social media on diseases such as diarrhea can be helpful and for patient engagement or for promotion of preventive measures? We'd like to hear your views on it.
I think digital awareness is really, it has a lot of potential. So it has potential in telling people how to do self-management of diarrhea, and it gives people common sense instructions on how to avoid diarrhea. Like I said, you avoid cut fruit, you avoid salads when you go and eat out, particularly, immediately after the rainy season when you expect the entire thing to be contaminated. So that those are common sense precautions. People don't understand that, but I think you can make the messages. Just to take a very simple thing, we know that children with diarrhea, you give them zinc for a period of 2 weeks. The reason is it helps the intestine, the epithelium to recover from the diarrhea, and it prevents a next quick successive episode of diarrhea. Now in Bangladesh, they popularized this jingle which had to do with baby zinc. So many people, the common person in Bangladesh is aware of ORS, is aware of the use of zinc in childhood diarrhea. And certainly I think social media can play a major role in limiting damage from acute gastroenteritis.
Thank you, Dr. Ramakrishna, for your views there. Moving on, Dr. Somnath, my next question will be for you. Considering the global compact's focus on sustainable business practices, how can ethical considerations be integrated into the pharmaceutical industry efforts in diarrhea's R&D and distribution? Over to you, Dr. Somnath. You're on mute, sir. If you can unmute yourself.
Yes. Thank you very much. Because I was hearing each and every eminent speaker and wonderful, insights they have shared. If we just look at the Indian scenario, healthcare, the status of India, definitely we are facing lots of challenges because it starts from the grassroots, the top level. So first of all, I would like to mention here the challenges where the PPP is required. To be very honest, I would like to mention here these days we are not calling public-private partnership. It has become now public-private preferred partnership, right? Because there are different, different needs of the community, different, requirements of the community, and the donors are ready to different support, different needs of the community. So for that purpose, we generally call it PPPP. So in India, we are just, facing challenges at different level, especially in healthcare sector. First of all, awareness level, because diarrhea is not such a big issues, but as Dr. Ramakrishna and other my co-panelists has said, if they maintain proper the awareness and that what the recommendation doctor is tell them, definitely this diarrhea can be stopped or reduced, blah blah blah. But there are 4-5 stages where each and everyone need to be emphasized. One is awareness generation or giving education to all kind of categories. So in that context, when we just talk about the public-private partnership, we request the civil society organization to just play an active role, because they are connected well with the community at urban level as well as at rural level, where people have very less access to the healthcare services. So the second challenges that I am just facing, that is the service delivery level, where people have no money, have no resources to just cope up with their expenses, to bear their medicine expenses, where pharmaceutical sectors can play very important role. And definitely they are playing very important role, and Dr. Reddy's are just dealing in I think the medicine, and they are just doing a lot of things in terms of awareness generation and medicine and healthcare programs. I know it. So where pharmaceuticals company can play very important role. And the third is the healthcare infrastructure and maintenance, because government once prepare and provide you infrastructure, proper infrastructure to to manage or to fight that particular disease, whether it is diarrhea and other disease. But sometimes after a period, this infrastructure just the destroy or just stop working. So in that purpose, the private sectors, the companies, the corporate can come in and play and very active role to just maintain that infrastructure, so that healthcare sector can be improved. But this is only possible, as you said, that in terms of global compact, the perspective where the integrity parts come, where the compliance part comes, where the good governance part comes, because our entire process and our entire strategies revolve on three major things. This is good governance, ethical practices, and transparency. So generally we have to ensure at every level, whether it is service delivery level, whether it is recruitment level, whether it is healthcare providers level. So we have to be accountable and very provide very ethical services to the patient. So definitely the environment they provide to the patients, generally patient just feel half cured, with the good behavior, good attitude of the doctors. So we have to just emphasize on the ethical business practices from the healthcare providers as well as other service delivery level point of view. And the integrity part also emphasize on accountability and ownership. Accountability doesn't mean that all the healthcare providers, whether it is healthcare organization or simple doctor, they should be accountable. Even the community has to be accountable for it, because the whatever recommendation or suggestion given by the doctor, whatever prescriptions given by the doctors, they have to accountable for that, because first of all they have to care for their health. As well as the same things come to the ownership. We generally put blame on the government and the healthcare providers that they are not taking ownership, but ownership should also be taken by the community level, where the if you just move to a village, sarpanch is there, some pradhan is there. If you just move to slum areas, you can find pradhan is there, where entire community follow their term, follow their what they tell to them. So they have to show their ownership to be engaged in health strengthening program, and to support the healthcare providers or the government to take this initiative forward. As Dr. Ramakrishna and Dr. Rupa already talked about, that diarrhea is a question of health and hygiene, right? Which need very small awareness. But who will just create this awareness? Number of civil society organizations are working in the field, but if any myth is spreading in the community, definitely they will not accept any treatment or love. But for that purpose, we have to all the sectors come together and start taking ownership in this initiative, and definitely through this approach, this diarrhea can be eradicated permanently. So this is the basic, you could say the value of the United Nations Global Compact, that we have to work as a responsible business, ethical business. We have to work for spread work for with a good governance approach. And the third is we have to be good transparency within the system, so that we can benefit the actual the beneficiaries, and definitely they can get benefit of it, and we would be able to achieve our healthcare goal. And generally, among all the sustainable development goal, we focus on goal number 17, where we just invite and talks about partnership for the goals for any of the issues, whether it is healthcare, whether it is poverty, whether it is business, employment. We generally call all the sectors together to join hands with the government and other decision makers to get rid of this society from all the challenges like healthcare. Thank you, Dr. Nishan.
Thank you, Dr. Somnath. Very, very wonderful connecting the community awareness and the public-private preferred partnerships, as you had mentioned. Very, very nicely summed up. Dr. Rupa, my next question will be for you. As we know that technology is developing very quickly, you would, as a clinician over the last 2 decades, a lot of things from the technological side has developed. I'd like to hear in your experience, how do these technological advancements have helped in the diagnosis of IBS? And what future do you see that the treatment of IBS, along with these technological advancements, where is it all going? Dr. Rupa, you're on mute, ma'am.
I think this is a very good question because we are talking of AI and machine learning and deep learning, and we have the advantage of seeing it in real life. So I'll just highlight what we are doing, and with that example, show you how technology has penetrated. So the one example is, that we're talking, and I have been talking about inflammatory bowel disease, which actually needs early intervention and early treatment. Otherwise, long term, there will be need of surgery, there will be complications, there's increased risk of cancer. So we need early diagnosis. So look at technology. We now have, for the last 5 years, we've been going into the villages. Every day, a team goes in with a mobile van. Inside the van, there is a capacity to do endoscopy, colonoscopy, advanced procedures. So literally, we are taking advanced procedures to the doorstep. Now, look at the advancement. We can transmit whatever our fellows or junior colleagues are doing, they can transmit it directly to the main hospital, and we can guide them that, okay, now take a biopsy. Now steer right, get this out. Okay, no, this is a benign lesion. And diagnosis is at the doorstep. Okay.
Right.
Second, you're talking of technology, endoscopy. Earlier, small bowel we could not see. Now we have a capsule endoscopy. The patient swallows a capsule, it goes in and sends us a boring documentary of 8 hours of what is going on in the small bowel.
Right.
Now, if you do not have any of this, there is a stool test which is available and gives you results within minutes. Who are the patients that need more evaluation? So if you have 10 patients coming with diarrhea in the village, you just get this stool calprotectin done, and that will segregate the risk factors and tell you, well, out of these 10, these 2 are the people who need further advancement. So this is just in easy technology how it is helping. The other area, and I want to highlight that over here, is this, that there are no support forums for patients. We forget about the primary caregiver burden. A person who has a wife or a husband with a chronic lifelong illness, what does that family member go through? Primary caregiver burden is a most neglected aspect in this part of the world. We don't know what kind of insurance they should apply for. They don't know how to keep themselves happy. Technology can do that as well. We started the India IBD Support Forum, and now we have around 1,500, 2,000 patients who are constantly talking to each other, discussing. We give in the right inputs, of course, about new technologies. And I think mental health, another neglected aspect in the context of these newly emerging diseases and technology. So other than awareness, of course, we need that. I think these are the other aspects where technology has made a difference.
Thank you. Thank you, Dr. Rupa. Very, very insightful answer there. Mr. Prashant, my next question will be for you. As we are talking about the digital age, I also would like to talk about digital health startups. So my question for you will be, how can collaborations between pharmaceutical companies and digital health startups contribute to the innovative solutions of diarrheal awareness and education as we know in India? Please.
Yeah, I think the world is progressing at a blistering pace, right? In terms of the advancements in technology, science, and data is the new currency of everything. And in that, I think there are 3-4 large areas, and I can give some examples of how they are impacting and they will impact. The first thing is, very simple thing, but today we have platforms which are capturing electronic prescriptions. prescriptions being digitized, that itself changes the way in which we understand what is happening in terms of what is getting prescribed, how many people are actually coming with this condition, what was presented. So not just prescriptions, but the entire aspect of electronic medical records, electronic prescriptions is now the new data, which combined with the power of analytics can actually tell us many things that we didn't know about what is happening in the community. It can help us forecast if there is an epidemic. It can tell us whether there is the treatment protocols are being followed or not. It can also say what is effective, what is not effective. So this is a very simple example by which digitization of medical records, prescriptions can actually have a tremendous impact on, and there are many startups who are in this space right now. That's one piece. Second is the ability of, and thanks to the power of social media, we now have various ways in which we can reach the community, both the patients as well as the doctors, to both inform and to educate. So if we were to look at examples, doctors today can inform their own patients, in their neighborhood, in their towns, about what is happening, how to take care, because the power of Instagram and social media is such that today we see patients are following doctors on Instagram and looking at what is. Now, of course, this comes with tremendous amount of responsibility from the entire ecosystem, but it is a very powerful tool to engage and use some of these social media. um, uh, Interestingly, there is an initiative on Spotify. Spotify is one of those cool engagement entertainment arenas, where we have a podcast called Inside the Indian Gut, where doctors are talking about how to manage various conditions related to gut health. So the opportunity for engaging with patients is enormous, because we know that today one of the biggest boons as well as one of the biggest problems is the attachment to the mobile device, which people keep carrying around and keep looking. It is an epidemic of a different kind, but there are some positives in it, and we should use that. And that's what the power of social media and multiple other platforms, not just social media, but entertainment apps, there is a power there that we can utilize more and more. The third piece is, of course, using the power of technology to help the healthcare professional community itself be informed about what is happening in the advancements in science, or the new literature, new trials, new evidence that is being published on this condition. Dr. Reddy's has Doc Vidya, which is a platform which collates and is able to disseminate this information. And I think these platforms exist across the industry in various forms, and it starts becoming a huge resource for people to for the healthcare community to see the advancements, hear from international speakers, key leaders within the medical community, experts. The opportunity is enormous when we look at technology, and this is a combination of, I would say, digitization leading to more data, and this data can actually become more and more powerful if we apply it especially at a community setting. To the power of communication, the power of technology, the handheld mobile device is enabling information to be reached in various different ways, and both all the companies, the policy makers, doctors can make full utilization of this to actually disseminate the right information to people. And thirdly, various forums exist today by which new advancements in science and in the field of medicine, in the field of pharmaceutical development, can be disseminated, and opinions can be sought through platforms which does not require intensive meetings. But this is the way in which I think technology and digital can actually be used to have an impact on managing diseases.
Thank you. Thank you, Mr. Prashant. Very wonderful connecting those dots and listening your views on that. So with this, I'd like to bring this particular panel to a closure. I'd firstly like to thank all my audience. Dr. Somnath, I think you would like to say something here, please. You're on mute, Dr. Somnath.
Yes, because I just work with the Ministry of Health and Family Welfare, even the number of different national programs. So as Mr. Prasant said and Dr. Rupa said, this technology is playing very important role, not only in data gathering, data assembling. It is also giving actual information to the government, to the policymakers, to develop appropriate strategy plan and accommodate budget equally, so that healthcare sector can be strengthened. AI technology is also playing a very important role in stopping corruption incidents in healthcare sectors. So I think this AI is just really playing very important role to improve due diligence process in healthcare sector, as well as slowing down corruption incidences in these sectors. So definitely, with the help of this technology, this healthcare sector will improve and grow. Thank you.
Thank you. Thank you, Dr. Somnath. So as I was saying, we will bring this panel to a closure. I'd like to thank all the audience who have stepped up, engaged with us, and visited us. Secondly, I'd like to thank all my panelists here, Dr. Ramakrishna, Dr. Somnath, Mr. Prashant, Dr. Rupa, and Dr. Madan Gopal. Thank you for taking time out of your schedules and stepping up with Voice of Healthcare in educating about this very stressed topic of diarrhea and its challenges. And lastly, I'd like to thank, firstly, Dr. Reddy's for powering this particular panel, and UN Compact Global for supporting this particular panel of discussion. So to each one of you, to all the audience, I hope something was learned. And to each one of my panelists, thank you for spending time with us, and have a good day.
And thank you, Nishant, for you to organize such a wonderful panel discussion. Thank you, everyone.
Thank you, Dr. Nishant.
Thank you, people.